Just let's move to the next one. We have a left foot. Left foot. This is a CT scan of the left foot of a 47-year-old male patient. It says nothing, no clinical history. I'm downloading the image. Let's see if we can dig in some motive for this exam. I suppose it's trauma, because of course we have a exam request right there that it's so it's handwritten, but it's just it says something like it's a post-operate. It's a post-surgery scan of some kind of ankle surgery. I can't really tell because I can't read it. It's such a bad writing. It's impossible to tell, at least for me. And it's just 2 times the same scanned, impossible to read exam request. So it's here already. Let's just get it done. Of course, it's a ankle with a bunch of metal fragments. This is probably, oh yeah, see, this is orthopedic surgeon job, a beautiful job with bolts on the joint, just a bolted joint. Oh, it's beautiful, just a beautiful surgery. See, so nice. Just that, just a bunch of bolts through the bones, and it hurts. Go figure why. So just going to hit an MPR so you guys can enjoy this exam as much as I. And here we go. I suppose 2 things. I suppose this patient had a fall on his feet, trauma, and he had a major fracture of the calcaneus right there. See, major fracture there. They put a bolt through the calcaneus, and the bolt helped heal the joint, although it's not very well positioned, it as much as it can be done, I suppose. And there is a calcaneal spur right there, a plantar fascia spur, a bunch of plantar fascia spurs right there. And he also had a comminutive fracture of the talus of the neck, the anterior portion of the talus. To that extent, they put a couple of bolts through the fracture from the anterior and dorsal portion of the fracture towards the back portion of the talus, and it resulted in a pseudoarthrosis. So we have here a pseudoarthrosis, and there is fragmentation, sclerosis, and a bunch of sequestered bone fragments all over the fracture site. So there is soft tissue attenuation in between the fractured portions of the bone. This is clearly a major possibility for a chronic osteomyelitis, a chronic infection of this bone, because there is metal. This is a post-surgical patient. This has happened a bunch of weeks ago, at least 4 to 8 weeks, because we have a healed fracture. And of course we have the three major signs of bone infection, which is sclerosis, sequestered fragments, and non-consolidation. So we have densification of soft tissue right there. We have non-consolidated fractures. We have a bunch of fragments, sclerotic fragments separated from the main bone fragments. So this is probably a chronic osteomyelitis patient right there. Also, we have arthrosis of the ankle, of course. We couldn't be without that. And also the tarsal bones do show signs of arthrosis right there. The navicular. Oh, I'm sorry. I'm all wrong about this. I'm sorry. This isn't fracture. This is an arthrodesis. Now that I'm just, yes, you guys are clearly screaming at me right now. This is a destroyed scaphoid bone, and the talus is just from here to there. This is an arthrodesis. This is a scaphoid, talar, scaphoidal, or scaphoid talar. I'm sorry. It's also called a navicular bone. So this is a navicular talar arthrodesis. They put this both through the two bones to make them a single bone, but they didn't properly fuse together. So yet this is a pseudoarthrosis, not a proper arthrodesis. I'm sorry, got carried away. Still, it seems like there is some infection right there. I didn't just realize there was a, yeah, see, fragmented scaphoid bone right there, and a destroyed talus. Yes, and there are even cavities around the bolts, which are missing here. See, this bolt is well placed, no cavities around it. And this is a bad bolt. There are cavities around it on the scaphoid bone. There isn't a fusion right there. There are sequestered bone fragments all over the place, and also sclerosis and deformities and some sort of erosion all over the bones. These are clearly, see, clearly sequestered fragments right there. So this is most probably a pseudoarthrosis with clear signs of osteomyelitis, chronic osteomyelitis. There is also arthrosis of the syndesmosis right there, the distal talofibular, tibiofibular syndesmosis. And this is, as they call, a shit show. So let's report it. There is diffuse demineralization of bone right there. This is going in my report. Deformity and a fused consolidated fracture of the calcaneus. Plantar fascia intersophates or entesophytes or bone spurs right there.